Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Let me introduce myself for you. My name is Aninda Dehiryanti. I'm the 2 nursing student at Poltekkes Kemenkes Tasik Malaya. And in here, I want to show the article journal about strategy of providing education to improve patient outcomes of orthopedic surgery patient literature review. This is journal article by Eni Purwanti and Riri Maria. Okay, the number 1 is abstract. The success of orthopedic surgery patient education depends on many factors, including the accuracy in cushing methods and the educational media used. This selection is based on consideration of the appropriateness of the material provided for the patient need and the learning objective to achieve. The study aimed to describe and provide comparison of the types and methods of education that can be done in orthopedic surgery patients to improve patient outcomes. The references employed in this literature review were 11 experimental research articles published from 2010 to 2018. The keywords appropriateness in the search were orthopedic patient, patient education, patient knowledge, education method, and patient outcome through the progress. ABCO, sense and clinical key. This review showed that the media and educational methods vary widely, including face-to-face education, web-based or internet-based education, education with DVD videos, and structured education. Okay, the next journal article by background or introduction. And number 1, orthopedics is branch of the surgical science focusing on conditions which involve musculoskeletal systems, conditions that possibly overcome by surgery. And number 2, World Health Organization in 2015 estimates that more or less than 11% of disease in the world is derived from illness or condition that possibly overcome by surgery. And number 3, WHO explains that there is a significant improvement of total patient with surgical operation years by years. And number 4, the main focuses of orthopedic surgeons are patient knowledge and physiological readiness to the preparative. Okay, the effort of increasing patient knowledge and readiness needs support from all health team who are competent in caring patients so that the best caring can be achieved. And number 5, one of the intervention affecting patient improvement and readiness is educating them. And number 7, it is in line with patient work to achieve information related to the disease which starts from understanding their disease and treatment procedures until patient preparation to go home. Okay, and the next journal article by literature review. Okay, by literature review, this study aims to describe and compare the type and methods of education which can be used for orthopedic surgery patients to improve patient outcomes. Okay, the next journal article by method, an article review is categorized as a literature review investigating previous studies on specific topics or questions as a particular science. Number one, the journal where experiment research, and then number two, the treatment with patient education methods intervention. And number three, a dependent variable with upgrading patient knowledge and self-capability. Number four, the journal respondents were orthopedic patients. And number five, the result of this research were published in 2010 and next 2018. Okay, the research question was arranged by PICO framework for orthopedic surgery patient, I for patient education method, and for knowledge improvement and self-capability. Okay, the next journal article is discussion. Number one is only learning features teaching basics anatomy and pathology give basic knowledge to the patient as their preparation to achieve more detailed information or question the doctor or nurses. Number two, information possibly accessed by the patient through the web is only general information. Number three, in general, it is predicted that a web-based learning can save costs and is more comfortable. And number four, patients who use internet-based education such as web or social media are mostly young people and having residents with long distance to health service 120 until 118 miles. And number four, web-based education with controlled information is one way to increase patient knowledge and reduce the time spent by health workers to re-educate patients when patients make repeat visits. And the next journal article is results. Number one, by study description. Number two, education strategy. And number three, face-to-face traditional education. And number four, web-based education. Number five, educational DVD audio videos. And number six, structured patient education. And number seven, the effects of education strategy on patient outcome. Okay, the next journal article is conclusion. Patients play an essential role to succeed in the pre-operative education process. Thus, they are more aware of their perioperative process and when to be involved in recovering their health condition. Professional nurses or other healthcare teams must enable to give preoperative education to orthopedic surgical patients by utilizing the right education strategy without referring to specific educational media or methods. And consequently, the educational orientation is achieved. It is a profit that all methods and media such as face-to-face education, web or internet-based education, DVD, audio, video education, and structured education can increase patient variable value of orthopedic surgery knowledge and skills during perioperative phase. Oke, thank you. Sekian presentasi terkait jurnal artikel dari saya pribadi. Kurang lebihnya mohon dimaafkan. Wassalamualaikum warahmatullahi wabarakatuh.